बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is female 25-year-old young patient with history of neck pain, neck swelling and mild tenderness over the frontal lower neck. So I'm going to scan the neck region. I have seen the other neck glands like submandibular parotid. Now I'm going to scan the thyroid gland. Here we can appreciate that this is the right lobe of the right lobe of the thyroid gland, and we can appreciate the gland that it is hypoechoic and it is heterogeneous in echo texture, and the borders are irregular, and this lobe is bigger in size. It is enlarged, and if we see the isthmus, this is the isthmus of the thyroid gland, and posterior to it is the tracheal and posterior shadowing. So this is also heterogeneous, having the same appearance as the right lobe. And then I am going to see the left lobe. Left lobe is also bigger in size, hypoechoic and heterogeneous in echo texture. So normally this is not the appearance of the thyroid gland. So I am going to show you the normal appearance. This is the abnormal gland, and I am going to show you the normal appearance. And look here, this is the normal right lobe of the thyroid gland, which has smooth echo texture, hyperechoic with smooth border, and you can also compare it with the abnormal right lobe of the thyroid gland, which is significantly bigger in size, heterogeneous and hypoechoic and irregular border. So this is the grayscale findings of the both lobes of thyroid gland. So I am going to check the vascularity of this disease thyroid gland. Look at the vascularity in the right lobe of the thyroid gland. This is the isthmus, and this is the left lobe of the thyroid gland. We can appreciate the significant increased vascularity in the both lobes of the thyroid gland. This is too much significant. Even this vascularity has obscured the right lobe and left lobe. Too much vascularity. Such type of vascularity, in the sonographic language, it is called thyroid inferno. When this is the classical sign, this thyroid inferno is classical sign for the two disease process in the thyroid gland. Number one is the grave disease, and number two is the chronic lymphocytic thyroiditis, or it is also called Hoshimoto thyroiditis. As we can appreciate that this is significant bigger in size, and the grave disease usually the thyroid gland or the right lobe or both lobes, or they have smooth ecotexture, not too much heterogeneous, a very smooth outline. While in the early stage, as this patient gives the history within the 20 days, she is giving history of 20 days. All these symptoms appears. So this is the 20-day history and such appearance of the thyroid gland in 20 days. So in the top priority, I would, in my opinion, this is the likely diagnosis is in this picture is the Hashimoto disease or the chronic lymphocytic thyroiditis. Look at the so we will go for the hormonal laboratory finding. What is the condition? Finding that the T3, T4 and thyroid stimulating hormone, as it is in the initial stage, so these lobes are bigger in size. With the passage of time, due to this disease process which is autoimmune, these both lobes will go on shrinking. Ultimately they will both will have small size, however such increased vascularity will maintain. Again I am going to show the vascularity. Look at this. Color mixing, aliasing, significant increased vascularity is present. So in conclusion, this is the case of Hashimoto thyroiditis or chronic lymphocytic thyroiditis, which is characterized by the combination of enlarged both lobes of thyroid gland, which are hypoechoic, heterogeneous, somewhat nodular, and irregular borders, showing the significant increased vascularity, thyroid inferno. Thank you very much.